Hi everyone, welcome back to my YouTube channel, and today we are going to talk about glossopharyngeal nerve. So let's start our topic with introduction. Glossopharyngeal nerve is the ninth cranial nerve. It is mixed nerve that contains motor, sensory and parasympathetic fibers. This nerve plays a crucial role in taste sensation, swallowing and autonomic control of salivation and blood pressure. Nuclei and origin of glossopharyngeal nerve. Glossopharyngeal nerve arises from four nuclei in the medulla oblongata. They include nucleus ambiguus that gives motor fibers to stylopharyngeus muscle. Second nucleus is inferior salivatory nucleus that gives parasympathetic fibers to the parotid gland. Third nucleus is nucleus structus solitarius that gives taste sensation and visual sensory input. Fourth is spinal trigeminal nucleus that gives general sensory information from pharynx, tongue and ear. Course of glossopharyngeal nerve. First, it has intracranial course that start when it emerges from medulla oblongata as a series of rootlets. Then it exits the skull through the jugular foramen, and it processes two sensory ganglia that include superior ganglia or jugular ganglia and inferior ganglia or petrosal ganglia. Then its extracranial course starts when it exits from the jugular foramen, and then it descends between internal carotid artery and internal jugular vein. It gives off multiple branches to pharynx, tongue, carotid sinus and ear. Branches of glossopharyngeal nerves include tympanic branch, carotid branches, pharyngeal branches, muscular branch, tonsillar branches and lingual branches. Tympanic branch is also called as Jacobson's nerve. It forms the tympanic plexus. It carries parasympathetic fibers to the parotid gland. Second branch is carotid branches that carry sensory input from carotid body and sinus that includes baroreceptors and chemoreceptors. Third branch is pharyngeal branches that form the pharyngeal plexus with 10th cranial nerve and 11th cranial nerve and supplies sensation to the pharynx. Fourth branch is muscular branch that innervates the stylopharyngeus muscle. Sixth branch of glossopharyngeal nerve is tonsillar branch that gives sensory innervation to tonsils. And sixth branch is lingual branch that gives general sensation and taste from posterior one-third of the tongue. Functional components of glossopharyngeal nerve. First, it has motor component that control stylopharyngeus muscle that aid in swallowing and elevation of pharynx. Second component is sensory component that gives taste and general sensation from posterior one-third of the tongue, and also sensation from pharynx, tonsils, soft palate and ear. And also it gives sensory innervation of carotid body and sinus for blood pressure and gas detection. Third functional component of glossopharyngeal nerve is its parasympathetic component that gives secretomotor fibers to parotid gland through the aortic ganglion. Functions of glossopharyngeal nerve. First is taste sensation from posterior tongue. Second function is it monitors blood pressure and blood chemistry through carotid sinus and body. Third function, it provides salivary secretion to parotid gland. Fourth function is it contributes to swallowing and gag reflex. Central connections of glossopharyngeal nerve. Taste fiber terminate in the nucleus structus solitarius. Motor fibers arise from nucleus ambiguus. Parasympathetic fibers originate from the inferior salivatory nucleus, and general sensory fibers project to the spinal trigeminal nucleus. Clinical significance of glossopharyngeal nerve. First is glossopharyngeal neuralgia, that is severe sudden throat, ear or tongue pain due to nerve irritation. Second is loss of gag reflex. As ninth cranial nerve, that is glossopharyngeal nerve, supplies the afferent limb, and its damage causes absence of gag reflex. Third significance is taste loss, as loss of taste sensation from posterior third of tongue occur because of glossopharyngeal nerve damage, because it supplies taste sensation to posterior one-third of the tongue. Fourth significance is carotid sinus dysfunction. It causes dysfunction or damage of glossopharyngeal nerve causes impaired regulation of blood pressure. Fifth significance is lesion of ninth cranial nerve. They are rare and they are often associated with 10th and 11th cranial nerve damage due to their proximity in jugular foramen. Summary. Glossopharyngeal nerve is mixed cranial nerve. It originates from medulla oblongata that exists through jugular foramen. Its major roles include taste, that is at posterior third of the tongue, salivation, that is by the parotid gland, and carotid sinus reflex and swallowing. It is important for gag reflex and monitoring cardiovascular status. And this was all about glossopharyngeal nerve. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.